This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Heart disease is one of the leading causes of death in the United States. At Mercy Health, their team of interventional cardiologists make sure you get the highly specialized individual care you need when you need it. We visited the Mercy Health Kings Mills Hospital to learn more.
My name is Brian Cothern. I'm a cardiologist here at Mercy Health. I cover both Fairfield and Kings Mill Hospital. Specifically, I'm an interventional cardiologist, which means that I specialize in placing stents, doing heart catheterizations or coronary angiograms, as well as putting in heart pumps and temporary pacemakers if need be. We see the full breadths of cardiology here. We see, specifically from an interventional standpoint, abnormal stress tests, patients with chest pain, patients with concerning exertional shortness of breath, things that may or may not be related to blocked arteries. We are more than happy to see any and all of those patients and figure out what the best treatment option may be, and whether that's not an interventional procedure or not, we're happy to offer that and dig more into it for them. Here at Kings Mill, we have a lot of interventional cardiologists here right now. There's not a lot of hospitals between Cincinnati and Columbus, and it's amazing that they haven't had a hospital implanted here a long time ago. As busy the area that this is, with Kings Island right next door, we're happy to be located in such a community that needs it. We have a brand new state-of-the-art cath lab, which you're seeing behind me. One of the things we're trying to do is create new clinics to get patients seen more efficiently and expeditedly so that they're not waiting for months on end. And I think that's really one of the biggest things that we're trying to do right now for patients. Anytime that you're concerned about exertional symptoms, inability to walk, inability to do your normal day-to-day activities with experiencing chest pain, shortness of breath, just fatigue and inability to do these things, could be warning signs that there may be a blocked artery, and we're more than happy to see you. If you want to see your family doctor first and see if it's the appropriate referral, we're more than happy to follow along with them as well. Any patient that has a heart attack or receives a stent, we refer them to what's called cardiac rehab. And the way I try to best explain it is if you break your leg, break your ankle, you need physical therapy. And it's the same thing from the heart side. These are specialists that know how to take care of patients after major heart events. So they'll talk patients through all of these things, dietary changes, lifestyle changes, watching their heart and their blood pressure while they're getting back into shape and doing all the things that they probably haven't been able to do in quite some time. We're happy to be here. The hospital's beautiful. The equipment is all state-of-the-art. We are a very experienced group of cardiologists, and we're happy to offer our experience and our expertise here. I'm at a brand new hospital and continue to grow and build in this community.